Holistic treatment for depression. Depressive illness affects 1 in 10 Americans, appears to be growing, and affecting children at earlier ages. Percentages of major depressive disorder range from up to 2% of children under age 12 to 8 to 10% of adolescents and 10% of adults. The American Medical Association indicates there are so many causes of depressive illness, it can be difficult to determine. However, there appears to be links to the function of neurotransmitters, norepinephrine, serotonin, and dopamine, and the effect they have on depression. Many conditions appear to affect the levels of these neurotransmitters. Diseases such as Parkinson's can reduce the level of dopamine. Some cancerous tumors can secrete serotonin, causing an imbalance. Imbalances in the functioning of the hypothalamus, adrenal, thyroid, or pituitary glands may lead to depression. Illnesses such as diabetes, mononucleosis hepatitis, pneumonia, HIV/AIDS, CFS, SLE, multiple sclerosis, Alzheimer's disease, heart disease, and stroke have been linked to depression. Nutrient deficiencies such as the B vitamins, niacin, folic acid, vitamins A and C, calcium, iron, magnesium, selenium, and zinc may contribute to depressive illness. Research has shown some 200 medications can have a side effect of depression. Medications for high blood pressure, prescription pain medications, anticonvulsant medications, and even oral contraceptives can cause depression. American allopathic treatment. Western medicine for depression usually recommends antidepressant medications. Antidepressants work by altering the brain's supply of neurotransmitters and are divided into categories based on the effect they have on the brain. Tricyclic antidepressants have been used the longest and work by blocking the uptake of norepinephrine and thereby increasing the amount of it in the brain. MAOIs help to increase the levels of neurotransmitters by interfering with the production of monoamine oxidase, a substance found in nerve endings that breaks down neurotransmitters. SSRIs increase the brain's supply of serotonin. Atypical antidepressants may act on any of the neurotransmitters depending on the medication. Lithium is believed to operate in treating depression by slowing down the reactions of certain proteins that regulate the act. Antidepressant medications have a wide range of side effects, and 35.9% of patients report adverse effects. Tricyclic antidepressants affect other neurotransmitters that help regulate certain body processes. This leads to side effects such as sleepiness, drowsiness, dry mouth, constipation, difficulty urinating, vision problems, dizziness, or a racing heart. Less common side effects are rashes, sweating, tremors, delayed or reduced sexual functioning, weight gain, and dry eyes. Side effects of MAOs include dizziness, changes in blood pressure, weight gain, sleepiness or insomnia, reduced sexual functioning, swollen ankles and fingers. Less frequent side effect can be dry mouth, constipation, blurred vision, and difficulty urinating. Because SSRIs target only serotonin, they tend to produce fewer side effects than tricyclics or MAOs. Side effects can include insomnia, nervousness, agitation, nausea, diarrhea, and headaches. Occasionally, SSRIs can cause sexual side effects such as diminished interest in sex, arousal problems, and difficulty achieving orgasm. SSRIs have also been shown to speed up bone loss. A study published in the June 25, 2007 issue of the Archives of Internal Medicine reports an up to 60% greater bone loss and a twofold increase in fractures of older patients using SSRIs. About 40% of people on lithium experience side effects of digestive problems like nausea, vomiting, diarrhea, and stomach aches. Excessive urination, tremors, weight gain, acne, dry skin, headaches, sleeplessness, and exhaustion are also often experienced. Lithium will interact with medications such as aspirin, ibuprofen, and the antibiotic tetracycline, increasing the levels of lithium in the blood to dangerous levels. And antidepressants have reported up to 31 deaths per million prescriptions filled. Clinical trials of psychotropic medications have shown that placebos used in the trials to be 50% as effective as the medications, and typically 20 to 35% of patients fail to respond at all to antidepressant medication. Naturopathic holistic, alternative or complementary medicine has been treating mental illness for thousands of years, and its effectiveness is currently being supported by clinical trials. St. John's wort is the leading medication for depression in Germany, and sales of the herb are reported to be in excess of 00 million. In the US, St. John's wort is believed to act similar to antidepressants by inhibiting the action of neurotransmitters. In controlled studies using St. John's wort, it was found to be as effective in treating mild to moderate depression as antidepressant medications, with far fewer side effects. In fact, the frequency and severity of side effects has been considered clinically insignificant. However, the FDA warns about possible drug interactions when using it in combination with other prescription medications for HIV, transplant medications, cancer treatment, and antidepressant medication. In studies comparing SAMe with tricyclics SAMe, performed the antidepressant medications. SAMe may act like an antidepressant or on cell membrane structure in easing depression. SAMe also appears to have a quicker response rate than antidepressants, where patients show improvement in 7 to 14 days compared to an average of 21 days for antidepressants or St. John's wort. However, SAMe has been shown to have a positive reaction when combined with antidepressants, unlike St. John's wort. Other herbs, although with less clinical evidence, are also believed to have positive effects in treating depression. Ginkgo is believed to treat depression by increasing the oxygen supply to the brain and by increasing dopamine levels. Ginseng also increases blood flow to the brain and is believed to relieve depression by its ability to reduce stress, improve mental concentration, and mental performance. Kava works as an antidepressant by acting as a central nervous system sedative, targeting the limbic system, which regulates moods and emotions. Lavender, an aromatic herb, has been used for a variety of mental disorders such as depression due to its ability to relax. Other essential oils are used frequently in aromatherapy for relaxation, such as bergamot, clary sage, geranium, and neroli. Nutritional treatment for depression includes limiting foods that are harmful to the body, increasing foods that are beneficial, and supplementation. Traditional Chinese medicine believes depression is caused by a stagnant liver. Foods that are rich, greasy, and high in saturated fats cause a stagnant liver. Limiting such foods and increasing natural foods like brown rice, whole wheat, vegetables, fruits, wheat germ, and microalgae help cleanse the liver and provide vitamins and minerals that may be missing from the diet. Protein from turkey contains tryptophan, an amino acid that has a calming effect. Protein from chicken or fish lower in saturated fat contain dopamine and norepinephrine. Essential fatty acids found in fish, marine animals, and soy have been shown to provide the brain with needed nutrients for proper functioning that prevents depression. Supplementation of B complex. Vitamins B1, B6, B12, folic acid, niacin, vitamins A and C, minerals of calcium, magnesium, selenium, and zinc are necessary for proper mental health and have been used as treatments for depression. Therapies such as acupuncture, exercise, light therapy, yoga, massage, biofeedback, meditation, and hypnotherapy all offer non-drug alternatives for treatment of depression. Acupuncture has been shown to be as effective as antidepressants, and exercise has been proven to be as effective as psychotherapy in relieving depression. Holistic mental health for depression. Antidepressant medications that are combined with psychotherapy may be recommended for severe cases of MDD. However, antidepressant medication usually comes with a host of side effects, ranging from mild to severe, life-threatening, and in many cases, has no effect on depression. Medication also does not appear to uncover the cause of depression. Alternative medicine has been proven to be as effective as antidepressants, without the side effects. Daily naturopathic treatment for depression could include supplements of St. John's wort, SAMe, ginkgo, ginseng, and kava all have been shown to be effective treatments for depression. Herbal interventions should not be used with prescription medications, and patients should always check with their physicians before combining alternative treatments with prescription medications. Asterisk nutritional intervention may, in fact, uncover causes for depression and offer a non-medication approach without side effects. A diet of natural foods such as vegetables, fruits, and whole grains, fish and soy, and one devoid of saturated fats, red meats, greasy foods, and artificial additives can help cleanse the body and mind. Asterisk supplements of B complex, vitamins A, C and D, minerals of calcium, magnesium, selenium and zinc are necessary for proper nervous system function. Asterisk smoking and excessive caffeine also should be avoided as they interfere with the nervous system. Asterisk therapies such as aromatherapy, exercise yoga, acupuncture massage, biofeedback meditation, and hypnotherapy may complement other therapies when used with nutritional intervention and supplementation or herbal medicine in treating depression. Disclaimer. This above article from Holistic Mental Health Revised contains suggestions on treatment for mental disorders that the reader should be aware that are in fact suggestions only. Treatment for medical conditions should always be conducted by your healthcare professional. According to the FDA, only physicians are allowed to prescribe medications, and the suggestions in this book are for dietary changes and / or supplements only. Holistic Mental Health Revised is reporting research by the medical and alternative health fields. The reader should also be aware that supplements such as vitamins, minerals, and herbs can interact with medications. They could have contradictory reactions, negative or complementary reactions increase with prescription medications. The reader should always consult with someone knowledgeable of such interactions before changing what they are taking.